Fertility can be restored after certain cancer treatment options. It's a little bit different between the different treatment options. Obviously, if you've had a surgery and a uterus has been removed, that's difficult. We can place that back, although actually in some institutions, they are doing uterine transplantation, where the uterus is moved out of the way and then later transplanted back. So for cervix, we can remove part of the uterus and do something like a cerclage to hold the uterus together for pregnancy later. But if we think about removing the ovaries, for example, obviously we cannot place those back. So we have to think about the options before. So at the Ohio State University James Cancer Hospital, we have a specific oncofertility clinic also. So these are specialized providers, multidisciplinary, where we can get patients in really quickly, because these are usually decisions that have to be made in a very short amount of time, because as most patients are, they're anxious to get treatment started, and oncologists alike. So we want to limit that time. So that clinic is very specialized and gives recommendations on all the options and what would fit any particular patient the best.